patients are coming in, they're so afraid of fillers because they've seen what we call filler fatigue, or people who've had too much filler that start to look distorted and so forth. And so when they think of filler, that's what they think of. Are you experiencing the same sort of viewpoint from patients?
Yeah, no, I think everybody's scared of the F word, right? So it's filler fatigue, it's filler fear, and we're certainly seeing kind of this backlash against filler. And I think society has kind of rectified itself a little bit when it comes to the fact that we were overfilling a little bit. Our perceptions were a little bit off on kind of what looked natural, and I think everybody's trying to achieve a more natural look now. We're seeing patients asking for filler to be dissolved. We're seeing more of these more skin rejuvenation treatments rather than just filling. And I think a lot of that has to come with because there was a lack of training when it came to using injectables. Also, we didn't understand the anatomy that well. There's a disincentive, right? The more filler that you put in, the more as an injector you unfortunately make. So there's kind of a disincentive there from the patient standpoint. And then on top of that, there's a huge part of that puzzle piece that we were missing, right? So it's not just filling, because if you keep filling, you have these patients with balloon faces, and we don't want that, right?
Right.
As we age, after 25, we lose collagen and elastin, right? And so we're losing collagen, and our skin starts to stretch and start to sag. And we forgot about that huge piece of the puzzle, which is skin tightening, right?
Yes.
So if that balloon keeps getting bigger because we keep filling, but we're not really contracting that balloon, we start to look a little bit funky and weird. And so I tell patients when they come in is that skin tightening is the critical component. It's the most natural thing that you can do from a skin rejuvenation standpoint. And it helps keep everything lifted, and so that you have to fill a lot less because there's less skin to fill. And so I think that we're going to see in the next 10 years this whole shift towards skin tightening treatments early. That's Thermage, Softwave, Ulthera. There's a new device called Avava, which is a laser that skin tightens. And the way that it works is it improves kind of the sagging of the cheek, the jawline, keeps the jawline sharp, the double chin, it helps prevent that and also help remove it. And I think that that's just kind of the future when it comes to a total comprehensive skin rejuvenation protocol, and then you fill here and there as needed.
Right. I think it's important for people to understand that fillers are really designed to replace volume that you've lost. If you want to just maintain kind of the volume to your face, then that's when they come in. They don't lift, right? Some people claim that if you put fillers in your cheek, it's going to lift your jowls, and that's not necessarily true. That's not true actually at all, unless you're filling to distortion, which is not the look we're going for now.